Good morning, friends. I'm Dr. Divashree, Medical Director, Genia Fertility Center. Today we are going to talk on the hot topic called COVID and fertility. Before understanding COVID and fertility, let's understand what is COVID-19. COVID-19 means coronavirus disease, which is started in 2019. It affects mainly the respiratory tract, then causes pneumonia, and ultimately, if the infection is very severe, it can also cause death. Now, coming to how does COVID affect fertility, or does it really affect fertility? These are the answers for today. When it comes to COVID and fertility, COVID-19 is like any other flu virus. It affects the upper respiratory tract. When it comes to its effect on fertility, there is no evidence as such to say it affects fertility. Now coming to now the COVID pandemic is going on. Should we plan for pregnancy in the first place, or should we postpone till the COVID pandemic is over? See, one thing what you have to understand is fertility is a personal choice. When you want to get pregnant is a time that couple have to decide. But when it comes to postponing the pregnancy because of COVID, you have to be wise here, because any pandemic is going to last for 3 years. So, can you postpone fertility for 3 years is a question that you have to decide. But if you need any help, you can also contact the doctor whether it is safe to postpone pregnancy for 3 years in your case, because it depends on the reproductive horizon what you have. For example, if you are belonging to advanced maternal age, for example, if you are more than 35 years, already the number of eggs may be less in your case. So in these cases, is it wise to postpone pregnancy? Or if you are already suffering from certain fertility issues, you are already facing difficulty in conceiving, then is it wise to postpone pregnancy is also the question which has to be answered by a fertility specialist. So next, coming on to one more hot topic, that's vaccination, COVID vaccination. There are lots of doubts in the minds of people when the COVID vaccination or when it actually started. Everyone thought that, okay, is it safe? Is it really going to be effective? Does it cause any side effect? Let's few of them take it. Let others take it. Let's see how it is going to react or how is it going to protect them. Then we will take it. This was the mentality of many people when it was already there in the first wave. But when the second wave came, people are really, they are hit hard. Many of them have lost their families. Many of them have lost their close kith and kin. But now people are more aware about vaccination. So it's not about whether you get vaccinated, whether people are having doubt. Yes, people are definitely coming forward to get vaccination, but it is about vaccination and fertility. The few questions which people have asked me. One, should we take vaccination? And if at all we are taking vaccination, for which procedures we have to take vaccination, or for which procedures we should not take vaccination when it is pertaining to fertility? There's no such procedures wherein we can say, okay, this particular procedure you have to avoid vaccination. One thing what you have to understand, contracting a COVID-19 disease is more dangerous rather than getting vaccinated. Any vaccination would have side effects, but that does not mean every side effect is going to be life-threatening. But there are probabilities that when you get COVID-19 disease, the chances that you may succumb or you may land up in severe COVID-19 diseases quite high. So that's why it's always better to get vaccinated, whether you are planning for fertility treatment or planning for natural fertility. Next thing is it safe to take vaccination if planning for pregnancy, IUI or IVF? That already I have clarified that it is definitely safe to take vaccination when you are planning for pregnancy or when you are planning for fertility treatment. Then the next question is, should conception be postponed till vaccination is completed? As I told you, fertility is a personal choice. Whether you want to postpone your pregnancy till 2 doses of vaccination is completed is definitely your choice. But again, if you are already having problems in conceiving, it's better to consult your doctor, so that whether when to go for vaccination, when to go for fertility treatment, doctor will be able to tell you. The next question was when to start fertility treatment post vaccination. I would suggest at least 3 to 7 days gap after the vaccination dose is done. This is not because there is problem with vaccination, it is just that your immune responses should settle down before we start for fertility treatment. The next question was, is vaccination recommended in pregnancy? Now, it is beyond doubt that there are strong recommendations suggesting vaccination should be given even in pregnant women. But if at all, if it is given, when should it be taken? Is it in first 3 months, second 3 months, that is in the second trimester or third trimester? Most of the evidences say that in any trimester, vaccination can be taken, but most of them would prefer to give it in second or third trimesters. But remember, having COVID-19 disease in pregnancy is more dangerous than having a COVID vaccination. So, can different vaccine be taken for the second dose was the next question. So in this, I would say it's better to stick on to the same vaccine which you have taken for the first dose, because we don't know what are the immune cross reactions. Now, after all this, more than vaccination, more than your doubts about COVID-19 and fertility, it's very important to follow preventive measures. That is, maintain social distancing, wear mask every time, wash your hands frequently, and definitely take your vaccination at your turn. Thank you. And for any further queries, you can contact me on geniafertility06@gmail.com, or you can call me on 6360728115. Thank you.